Hello, my name is Morgan. I'm going to be talking about the paper I submitted regarding the opioid epidemic that America has been facing for quite some time. The first article I used came from the American Journal of Sports Medicine, and it talked about the different waves of the opioid epidemic that the United States has seen. So far, we have seen 3 waves with an increasing rate of mortality with each wave. This article also talked about how we would soon be seeing a 4th wave of the opioid epidemic. This kind of hit real with me. As a nurse and as healthcare workers, I feel like we should be doing more to stop or slow down this 4th wave from having an even higher mortality rate. So this article stated that about 130 people in the United States every day will die due to an opioid overdose. The articles I chose them because they all had numbers, and the numbers put everything in perspective for me and make it easier to understand how large this problem is. So I took that number and looked at it within a year, and then I went to the CDC and looked at the cost that would contribute within a year, and the CDC stated that we spend about $78.5 billion a year treating opioid overdoses. This includes, the healthcare costs, the loss of productivity, getting the criminal justice system involved, and getting addiction treatment for these patients. So I feel like with addiction, most everyone knows someone who's struggled with addiction, or if you don't know someone that you know knows someone who's struggled with addiction. The opioid epidemic is not something that's new to the United States. It has been around for the past 21 years, and I feel like nurses are still not comfortable with talking about the opioid epidemic and addiction with our patients. So I feel like that is the first step, is getting comfortable with talking about addiction and opioid overdoses with our patients. So if we need to get nurses trained to properly look for high-risk behaviors in patients, change in behavior. Family comes in and talks about changes in their financial status. We also need to be talking about this with our patients and their families, of what to look for. If we can discover these patients early on, we can give them the treatment that they need before an overdose occurs. Yes, training nurses more in depth on opioid overdoses and what to look for will cost hospitals money, but in the end it's going to decrease readmissions as well as decrease the mortality rate of overdoses and the things we use to treat those. I also, another article I looked at talked about talking about different types of pain and how different types of pain can be treated differently. A study was done across the United States with different non-pharmacological managements. One hospital talked about how they used acupuncture and that helped. Acupuncture can be more costly and require a lot more training, so they also did studies on acupressure. Acupressure shown to have been just as effective, and it didn't require as much training or as much cost to the hospitals. I also looked at another study that talked about non-pharmacological managements and using those before giving opioid medications. And these had numbers as well. This was done on a med-surg unit. It showed that 89.3% of the patients responded to distraction as a pain relief technique. 80% said that breathing techniques helped them, and 90.7% said that imagery techniques reduced their pain. With this being said, I feel like that it is very easy for providers and us as nurses to give the pain medication that is prescribed and not try anything before that. Not all floors have these everything available that they can use to give to try the non-pharmacological measures. There's heating pads, ice, massage technique, anyone can do that. So I feel like some of the factors that go into not being able to do this The barriers include, hospitals not having these supplies available for all the floors, the time cost, and the amount of time that it consumes going to these patients' rooms, the massage techniques, getting the heating pad. It takes longer, not as quick as just giving a pain medication and getting out. Some hospitals can't afford this, but if we looked at the cost, it would actually decrease the readmission rates for opioid overdoses, and we would have more beds available for other patients.